Go.
The framework queens. In 3, 2, 1.
The best leadership happens when you step away for 10 minutes.
This is Back in 10. Hello, everyone. Welcome to Back in 10. I'm Savannah.
And I'm Jen.
Today, we're going to talk about something very frustrating in dental practices. That's when a patient says yes to treatment. We're like, oh, yeah. And everything feels good. You think it's going forward. And then all of a sudden, they ghost you. They don't show up to the appointment. There's no follow-up. They're just gone. So, why do patients say yes to treatment and then disappear? Is it the patient? Is it something broken in our processes in the practice? Because sometimes this isn't a patient problem, it's a system problem. Jen, I know that you have some pretty solid framework around treatment acceptance, so I'm gonna let you have at it right now.
Okay, you don't even know this one because this
I
was
don't
in
know
a.
this one.
I know. Oh, I'm so
Lay it on me,
excited.
girl. I'll give you the feedback.
Oh, snap. Okay, so here's the deal. In my opinion, patients usually say yes because they care about us and they don't want to say no, right? They care. They don't want to hurt our feelings, but then they don't show up or they cancel their appointments. And it's usually because of us. It's because the patient is confused.
Yep.
About maybe they don't fully understand or they don't understand the urgency of the treatment that we've talked to them about because we haven't educated them enough for them to understand that. They're in fear. Maybe they worry about the pain or the outcomes or just the unknown. They are insecure or don't understand the cost behind it. So maybe how they're going to pay or what that will look like for them.
Yeah.
Or can they afford it? And then honestly, one of the big ones is we don't communicate in the practice the same. So we have different terminology for different things. There's mixed messages, right? Some practices will call it periotherapy. Some call it scaling and root planing. Others call it, whatever. Every term
don't understand it.
They don't. And it's because we're not communicating it from one team member to another with the same terminology and the same verbiage. Because let's be honest, everyone calls things different, like cap, crown. Majority of people now call it a crown, right? But is it restorative? Is it a composite? Is it a filling? You think about on your team who is saying these things and what they're calling it. If you do not have your team calibrated, the patient doesn't understand. So
education. I was speaking at a study club back in March, and I asked them what the biggest hurdles were right now that they were having in the practice. 89% of the attendees said holes in the schedule because patients do not understand their treatment. They just don't know. And like you said, they say yes based on emotion. They want us to be pleased with them, so they'll say yes. But then they leave, and then they think things over, and they think things over, and then they think, oh, I don't really know why I need this. Why am I going to spend $1,500 on a tooth that hasn't bothered me yet?
Right.
And like you're totally on point with it's an emotional first yes, and then it's the lack of education that gets them to ghost us. 100%.
Yeah. Okay. So you ready for this easy framework to remember?
All right. I'm God, is it an acronym? I hope so. You're the acronym queen.
It's 4 C's.
The 4 C's.
The 4 C's. Look at that. So the first one is clarity.
Yep.
So make sure that we are, oh no, I feel like I'm going to sneeze.
Go for it.
No, I don't know. We're just going to go with it. Okay. Woo, okay. It's tickle right there. That first one is clarity.
Okay.
And we want to make sure that we are giving a diagnosis to them, that we're going over everything with them, that we make it very easy to understand. So, in clarity, we're
Mhm.
going to tell them what our concern is, right? Prioritize the plan and avoid
Beautiful.
overload. Do not overload them with everything. Be very clear, very concise.
Yeah.
Okay? So that's our
Okay.
C.
Okay.
Essentially, like, I'm concerned that this tooth, if we wait, it's going to break. And the best way to protect this is a crown, right? So,
Yeah.
concern, solution, confidence throughout. Okay.
Yep.
So, the second C is confidence.
Okay.
Okay. So, we're going to speak clearly, calmly when we talk about tone. I know, Savannah, you and I have done the O exercise
Oh.
before. Exactly. So, clear and confident because we want our patients to we want to be able to let them borrow or share in our confidence because if we don't have confidence they are not going to say yes.
True.
Okay,
Yeah.
clarity, confidence. Number 3, consistency. So use the same message from hygiene to assistants, from operative to admin, everywhere, consistency throughout. So have a list in your practice. This is what we say, these are the terms that we say, and have that be part of your onboarding too,
Yeah.
right? Consistency. This is what it is. And then the last C is convenience. So give the
The biggest
patients,
one.
yeah, give them the tools, the time, and all of the options to move forward. So make it financially feasible for them to get the treatment that they need. You're going to have their insurance because really it's like a coupon, right?
There's your
So
bonus C coupon.
yeah. Yeah, it's your fun coupon. So your insurance is going to help with part of the cost, right? So say that instead of your insurance doesn't cover that because that's going to just automatically put the patient to a no or have
Yeah.
questions in their mind.
Yeah.
So really have that communication with your team and really just build that out and practice it. Go through that together, have it, have your hygiene team, your assistants, your admin be involved. I did this recently and I said, okay, how often is it that your admin team is busy and you're not able to do that handoff like hygiene to admin? Don't just write it on a sticky note. Your patient
Yeah.
needs to verbally hear that. So if you are not going to be able to be available, then pass it off to an assistant and say, hey, Savannah, I have this patient that I really need to make sure that this information gets conveyed to our admin team. Dr. Smith really needs to put a crown on number 2 because there's a crack in it. This is this is time sensitive. Please make sure that they get booked as soon as possible. Right? Pass that off to them and pass that information. If your patient says, "You know what? We want to just wait until next year." Like practice that. What things
Mhm.
are you going to say because they don't understand the urgency then, and usually it's, like, towards the end of the year that patients will say that because they know that they've maxed out of their insurance benefits. You and I have both dealt with that
Mhm.
time and time again, but being able to help them understand the urgency of it, because it's probably gonna cost more and take a
Yeah.
lot more time if they wait, but be able to pass that information off to someone else who then can pass it off, but practice it together. Everyone loves a good role play, baby,
I
so
do.
uh-huh. So practice it. Go forward with the team, but framework 4 C's: clarity, confidence, consistency, and convenience.
Mhm.
Those are the 4 C's for you today.
Mhm.
That's what I got.
And I think in consistency too, we can add in, we need like a not re- we don't need to constantly remind them of their appointments. Usually it's the larger appointments that our patients are ghosting us
Mhm.
on because they are the most expensive and have the lack of education. But
Mhm.
develop opportunities to continue the conversation with those patients when it comes to certain
Yep.
procedures too, to make sure that they know what's in store. Like, even if have the doctor pre-record a couple of videos about the procedures, and
Mhm.
a week before the procedure be like, hey, we can't wait to see you next week for this. I just wanted to go over again what it entails, how it's going to benefit you in the long run, and what happens if we don't do something about it now. It's
Mhm.
gonna potentially hurt and or be more expensive down the road. Like, you
Yeah.
it the continuing the conversation, I have heard from other admins who are working the schedule, they're reluctant to do it because they're afraid they're going to cancel when they do that. But
Mhm.
newsflash, it's called a value build. You are building the value of that appointment. And if they don't see the value, then that's when they boop, are going to
Right,
pop off. So
right.
have those, like Catherine Eitel says, those courageous conversations
Uh-huh.
um,
Uh-huh.
about their treatment. Because the more they know, if they do end up not showing up, you've done your due diligence as a clinician and as an
Mhm.
administrator in a dental practice to make sure the patient knew everything that was needed. So then
Right,
it's not on
right,
you. Like, you can't go back and be like, "Oh, we could have,
right.
sent 2 more emails or gave them a call." Like, you've done
Mhm.
that. You've
Mhm.
done what you needed to do. Now it's
Yeah.
on the patient. Put it back on them.
Right, and the technology also helps to get the patient to say yes and to stay in your schedule too, right? So,
Yeah.
making sure when we're talking about, like, the language that we use, like, you'd be surprised at how many offices have never looked at the emails that get sent for post-op emails or anything like that. They just assume that,
Mm.
the technology that they're using matches. But guess
Mhm.
what? If the technology is calling it a restoration and you call it a composite or you call it a filling, now the patient has no idea what's going on.
Right.
So
Right.
review your tech, review what is being sent out to patients, whether it's through text message, whether it's through email, like what terminology is being used.
Yeah.
Add those videos in there, personalize it to your practice.
Yes.
Even if you don't have the ability or maybe you're not super tech savvy, like put a patient of your doctor in there.
Yeah.
See it from your doctor, right? The one that diagnosed that treatment that they're in for. Like there are ways to do that.
Yeah.
So just make sure that you have the tools and the tech to back it to make sure that the patient is staying and it still stays top of mind. Now, hopefully,
Yes.
you're not booking them out so far. That's another whole issue
That's a
because
whole
the
issue.
further you book out, if it's important, like if someone has periodontal disease, they have a disease and an infection, and you can't see them for 6 months, guess what?
Yeah.
They're not going to come back in.
I kinda like to tell people to have the 8 mile approach. Do you know at all what I'm referencing from the 8 mile?
Well, I think I do, but
So
tell me.
okay, so the 8 mile approach, me and my homeboy Eminem, right? When Eminem is coming in for the rap battle, the culmination of this whole friggin' movie, right? He addresses everything to start before his competition can suss him out. He just puts it flat out on the table, right? So when we're talking to our patients about this treatment, right, have the 8 mile. You want to address every question they're possibly going to ask. Like, how much downtime is this going to take me? Am I going to have to skip work? Like, how long am I going to be sore? Like, just get it out of the way. Don't wait for them to ask the friggin' question. Eight
Right.
mile it. Just put it out there for them. And then in the end, you win.
Just
What? Me and my homeboy. But I feel like with him, it definitely would be this, not like the rock sign,
yeah,
whatever.
probably not.
But
Yeah.
anyways, but yeah, have the 8 mile approach. Just anticipate everything they're gonna ask.
Mhm.
Then it just makes it easy.
Mhm.
Right.
Love it.
Okay, sorry. That was
Love it,
my
love it.
my
No,
gangsta came out for you.
that was good. They got the 4 C's and a little gangsta,
A little
so
gangsta.
oh goodness. So,
I'm
look,
gonna rewrite that rap song
gonna
for
rewrite it?
yeah, I'm gonna rewrite it for dental.
Little sugar. Here we go.
Buddy,
Let's
knees wink, arms are heavy. There's saliva on his bib already. I don't know. Like, I
oh,
don't
goodness gracious. Okay, well, that's gonna be on an upcoming episode apparently. So,
it's the blooper of this one.
oh my goodness gracious. Everyone, if you have you know, conversations with your team.
Mhm.
Definitely role play this. This is not something to take lightly. Practice makes uh I'm not going to say perfect cuz no one is perfect.
Practice
Practice
makes
makes you
progress.
more confident in when you have some of these things come up. So, practice with your team, have the conversations and ultimately get those patients the care that they need and they deserve. That's our jobs.
Mhm.
Yeah.
Preach, girl.
Sounds
Alright, on
good.
that
Have a
note,
great day.
get after it. Thanks for spending a few minutes with us on Back in 10.
If something made you laugh, nod, or feel a little more human, share it with a friend and make sure that you're subscribed.
You can also follow us on Instagram at Back in 10 Pod for more behind the scenes, updates, and probably a little chaos.
We're not here to have it all figured out. We're just here to tell you the things that we wish someone had told us.
And remind you that leadership doesn't have to be perfect, just real.
We'll be back in 10.